Now here's a real twist. Outcomes in some cardiovascular trials are better in smokers than non-smokers. And some data show either a reduced or complete lack of clinical benefit from clopidogrel therapy in non-smokers. Now, how can that be explained? Importantly, this observation is not explained by an increased prothrombotic state in smokers relative to non-smokers. So how can this be? In JAMA, there is now a review of what might be going on. Cigarette smoking induces the activity of cytochrome P450, an isoenzyme involved in the metabolic activation of clopidogrel, and thus non-smokers have greater platelet reactivity than smokers during clopidogrel treatment. A recent analysis of the CAPRI trial revealed a significant interaction based on smoking status. Specifically, patients in the clopidogrel-treated non-smoker group had no reduction in the incidence of the primary outcome of ischemic stroke, MI, or vascular death, whereas patients in the clopidogrel-treated current smoker group had a significantly lower incidence of the primary outcome. In an abstract based on the CURE trial data, people never smoked and did not have a reduction in the primary outcome of cardiac death, non-fatal MI, or stroke, whereas current smokers treated with clopidogrel had a significantly lower incidence of the primary outcome. Similarly, in the CREDO trial, there was no difference in the occurrence of the primary composite endpoint in clopidogrel-treated non-smokers, whereas there was a significant benefit observed in clopidogrel-treated smokers. Finally, in Clarity TIMI 28, clopidogrel-treated patients who smoked 0 cigarettes or less had no significant benefit in the 30-day clinical endpoint compared with patients treated with placebo, whereas clopidogrel-treated patients who smoked 10 or more cigarettes per day exhibited a 46% reduction in the 30-day clinical endpoint relative to the placebo group. Does this mean we all ought to take up cigarettes? I don't think so. The risk-benefit ratio is still way in favor of non-smokers, but it is intriguing pharmacologically to think that cigarettes can perhaps enhance clopidogrel effect. I'm Peter Block, and this is a CardioSource Heart Minute.